Welcome. Welcome to the DNA Lab webinar featuring Dr. Morty Levy and Dr. Robin Murphy. I'm Michael Kersner. I'm chairman of the board and webinar call today. When we started our company a few years ago, and just a few words about us, the pursuit of great health and the lens of DNA was at our very core. Our story at DNALabs is a story really of exploration because in our own hearts, we are all explorers. Our team has always been driven to know what's beyond the horizon, what's the next discovery that we have to find. And the more we've experienced in our short time as explorers, we found a lot of great things. Today, we're going to talk about nutrigenomics, the benefits of nutrigenomics, and how really it can help people in their own lives. That's what really makes us different here at DNALabs. We've listened to the customers, we've listened to our stakeholders, and we want to produce a phenomenal product. And we think our Love My Health and our Love My Health Pro are really special. So today we're going to hear from Robin Murphy, Dr. Robin Murphy and Morty Levy. Just a brief word about both of them, which I think will help set the tone for the webinar today. Robin Murphy is a licensed naturopathic doctor, and her focus is hormonal and reproductive health at Conceive Health here in Toronto. She's one of our scientific advisors at DNALabs, and we're really proud of it, and a great advocate for educating the public about integrated medicine. So I welcome Robin to present, and I'll introduce Dr. Morty Levy after. Hi, Robin.
Hi, Michael. Thanks for the introductions. I'm just going to share my screen here. And you're right. I love advocating for integrative medicine. I think it's a hot topic that many are starting to become really interested about. And it's not about necessarily an either or type of picture. It's a hybrid model where we see conventional medical doctors and practices really starting to look at some of the kind of lifestyle components that contribute to health, as well as looking at other testing opportunities. And that's why I'm really excited to be a part of DNALabs. So obviously a genetics company, we're going to talk about genetics a little bit. And, when I was starting to think about, what is the topic for today, it's really hard to not think about where we're at this time and place. We are in the middle of a pandemic. We're going into potentially a fourth wave, and we're thinking about what is the norm that we're seeing. And what's interesting, what's really come to the forefront in my eyes is around mental health. And even before COVID, the topic of mental health started to be a topic of conversation. So we saw the Bell campaign, Let's Talk. This was allowing people to feel more comfortable to talk about their mental health, talk about it in the workplace, advocate for themselves, and really understand more about who is being affected and how can we advocate on their behalf. So today I'm going to be speaking a little bit about mental well-being. And when I looked at the stats, I mean, this is pretty remarkable, is that according to the CDC, and this was done in June of 2020, 40% of adults reported struggling with mental health symptoms. And so this is last year, almost, over a year ago, 40% of people, that's close to half, where 31% of people reported symptoms of depression, while 26% of individuals spoke about stress-related disorders. So this is a huge impact that it's having on our society. You think about the lost potential of people, whether it's in the workforce, in their relationships, or just their vitality and their contributions to their family and society as a whole. And not forgetting about Canada, of course. Stats Canada did their own investigation and found that 1 in 5 Canadians were positive for symptoms of depression, anxiety, or PTSD. So that's post-traumatic stress disorder. And this is incredible because this study was actually done between September and December of 2020. So you can imagine that over the last 8 months, this has probably gone up. And what's most shocking is young adults ages 18 to 24 are most likely to report symptoms of depression, generalized anxiety disorder, as well as PTSD. And there's also other vulnerable populations. So we found, it was reported that racial minorities, essential workers, so those are the doctors at the front lines, nurses, and unpaid adult caregivers are the most or experience disproportionately worse mental health outcomes. So this is a major topic that we need to think about and look at as doctors, as physicians, as companies. And I want us to kind of look at depression in a little bit of a different way. So typically when we look at mental wellness, there's an old theory of understanding which has to do with neurochemical balance. So this is talking about your neurotransmitters like dopamine, serotonin, how much do we have available, as well as how much is within the brain itself. And the typical treatments have to do with this sort of theory. So we're looking at antidepressants or anti-anxiety. There's a symptom there. And so we're going to give something to help sequel that symptom. When we take a step back and look at mental wellness from an integrative standpoint, we want to understand not only what is the pathophysiology, so what is the brain doing, what is causing some of these symptoms, but we want to see the underlying facets. So we want to know from a social and lifestyle factor, what are the predisposing factors that will contribute to mental health. So for example, we know that major life events, so this could be loss of a loved one, loss of a job, financial stress, social isolation. These are major life events in somebody's existence that will predispose to having a mental health disorder or experiencing negative mental symptoms, including child abuse as well as abuse at home too. So we have to look at, what are the predisposing factors? I talked a little bit about neurotransmitter balance. So this isn't just understanding about kind of what's available. It's also looking at how does the brain break down our neurotransmitters? How do they produce neurotransmitters? What's available? And are there any confounding factors which could influence the availability or distribution of these neurotransmitters? And I'll talk a little bit more about this in a moment. When we get to the basics and the foundations of anything in health, we have to look at nutrient availability. So nutrients, these are vitamins, minerals. This is the foundation to all of your cellular functions. And I don't think we really acknowledge this to the full capacity that we can when we look at the importance of certain vitamins and minerals. So for example, I think most people are familiar with vitamin D and its impact on depression. So the lower your vitamin D level, the more likely that there's an occurrence of depression. We also look at other nutrients like iron, vitamin B12, folate. All of these have a huge impact on your mental well-being. If you can't have the basic foundation vitamins to make the neurotransmitters, then you're not going to be able to have the appropriate amounts to facilitate a happy mood, motivation, even sleep quality. Weight is something that I don't think people think about when it comes to mental wellness, but part of the theory that's emerging when it comes to depression and anxiety has to do with brain inflammation. And if you think about when you have the flu, when you're sick, what are the symptoms? You feel lethargic, you feel apathetic, you don't really want to move, you don't have a lot of motivation. What do those symptoms sound like? It sounds a lot like depression. And what they found is that if you measure a certain inflammatory marker within individuals who are depressed, they have higher inflammatory markers, it's called IL-6, than kind of a control population or people with kind of quote unquote normal mood. And when it comes to weight and weight gain, this is considered kind of a generalized inflammatory state. So we know that fat tissue, as you grow and grow and grow, what happens is the blood supply to those fat cells become diminished. And so the middle of the fat cell, this large fat cell, it doesn't have proper blood flow. So it becomes partly necrotic and will develop more inflammation and inflammatory cytokines. So this kind of creates this whole systemic effect. And so the body becomes generalized and inflamed. And what's interesting is 2 out of 5 individuals during the last 12 months have reported an average of 29 pounds that they've gained. And that's significant. And what we're finding is it's mostly related to stress. And the pattern of stress weight gain, stress-related weight gain, is abdominal obesity, which means that there's more visceral fat. And this is the fat that is the most detrimental to our health. We know it can affect cardiovascular disease and is attributed to so many different chronic diseases, including depression. And the next topic, so gut health has a huge impact. I won't get too involved into this, but essentially your probiotics or microbiome, the bacteria within your gut, they actually will contribute to neurotransmitter levels within the digestive system. And this has been found to influence your mood, your cravings, sleep quality, and that there's been studies showing that just taking a probiotic can actually improve someone's mood if they have depression. And then when it comes to hormones, I mean, this is a foundation of our vitality. So if you are, happy, healthy, and you have a good libido, then this is kind of a good foundation to, a good mental state and mental wellness. So looking at hormone status, testosterone, estrogen, thyroid hormone, all of these are essential factors in our mental wellness. So when we think about, how do we look at treating mental wellness? How do we look at assessing mental wellness? We have to think about all these factors. Now, why am I talking about all of this when, we're talking on behalf of a genetics company? Well, I'll give you a hint. What's the common denominator between all of these? And so it has to do with our genetics. There's a predisposition that we find to each of these categories that we test for within the Love My Health panel. And so you can see here under specific nutrient needs, this is a list of everything that the Love My Health will look at. And so different markers, different genes will then predispose to different factors. So when we look at specific nutrient needs, this is related to genes that will either influence the absorption, the distribution, the utilization, or metabolism of essential nutrients. And I've highlighted the ones that have to do with mental health. So vitamin D, I know Dr. Levy is going to be speaking more about vitamin D and maybe get into some of the contributions of how genes will influence vitamin D levels. Iron is key. If you're iron deficient, a lot of people will develop anemia. And so omega-3 fatty acids, choline, probiotics. What's interesting is that Health Canada has a recommended daily allowance. And this daily allowance of how many nutrients they recommend for you to take in has to do with a generalized study. And this was done with relatively about 1,000 people, and they're looking at a bell curve. So they're looking at what is the average amount that you need in order to prevent deficiency. Now that's a key word. It's deficiency, not optimization. So at the very base, what do you need in order to quote unquote, not be deficient? Now, when it comes to our genetics, as I said, genes will influence the processes that your body needs in order to properly utilize these vitamins. So some people are outliers in that average. Some people actually need more based on their genetics. Some people need less. But without this information, you're kind of just shooting in the dark. You're guessing. And then perhaps you will go and do a blood test at some point in your life to see, are you deficient in these? But it's not done on a regular basis. When we look at neurotransmitters, mood, cognitive performance, susceptibility to stressful life events, and onset of depression and anxiety, these are influenced by genetic enzymes or genes that influence the enzymes that will influence the neurotransmitters. We look at risk for obesity, and that's a whole slew of processes that will influence risk. So it has to do with behavioral components such as regulation of appetite and food intake. So how satiated do you feel after a meal? Are you one of those individuals who tend to, eat a meal and then half an hour later are looking for something else? These hormonal processes are actually controlled by your genes and by the hormones that they influence. Do you have preferences for dietary fat? What is your eating behavior? Do you tend to snack more? Do you tend to eat most of your calories towards the latter part of the day? And what is your actual genetic risk score for obesity? When we look at food sensitivities, this kind of relates to digestive health as well as brain health. Gluten and lactose in particular have been shown to influence neurochemistry within the brain. So an interesting professor, he's a doctor in psychiatry, kind of specializes in schizophrenia. He found that gluten and casein, which comes from dairy, actually creates these glutamorphins, which bind to the brain. So it can affect our mood, affect our brain chemistry, if you're one of these ones who are sensitive to it. And then finally, we talked about hormonal health. So I'm going to give a few examples just to kind of highlight how understanding your genetic susceptibility can be imperative to understanding the treatment that's appropriate for an individual and for you. And it's not just looking at the neurochemistry, it's looking at kind of the person as a whole. So one key factor that I love, talking to people about is susceptibility to stress. I talked about how neurotransmitters, they tend to, it's the availability and binding of the neurotransmitter, which will influence your mood. And we actually have enzymes which will go in and remove those neurotransmitters. So on the left-hand side here, I just have a card that is an example from the actual test itself. So we look at mood, and in the top area, in the very bottom, it talks about in your genes. So we talk specifically about an enzyme called monoamine oxidase, so MAOA. And this is the enzyme that's breaking down some of these key neurotransmitters that are influencing our mood, as well as tendencies for symptoms like depression and anxiety. So serotonin, dopamine, epinephrine, norepinephrine. So your adrenaline, your dopamine, and your serotonin. So this is important because what they found is individuals who have certain genetic variants will have a decrease in MAO activity. So what this means is it can increase the availability of some of these neurotransmitters. So if there's more adrenaline, norepinephrine hanging around in the brain, this tends to lead to more anxiety, emotional arousal, more impulsivity. And knowing this about yourself is key. It's not just about the genes and what they do. It's about understanding that you may be prone to, say, irritability, aggression. You may need to put certain parameters in place to kind of help, I would say, save yourself, from yourself, essentially. But learning more about how you respond to stress and how you respond to some of these key stressful moments to get support and the necessary help. And in addition, we also give recommendations. So take action. This would be supporting these enzymes. I talked about how these genes can influence the activity of the enzyme. Well, you can take cofactors which will help to improve the efficiency of the enzyme, as well as avoid certain things which are common inhibitors and may exacerbate the effect of that. So proper therapies are in place. There's another gene which is in the same line, it's called COMT, so catechol-O-methyltransferase. This is just what we call the warrior versus the worriers. So do you have a tendency to be a worrier? Do you tend to crumble under stressful situations? It has to do with how your brain is actually processing the dopamine. And what they found is individuals with a slow version of this COMT gene or COMT enzyme tends to be, better, they perform better under normal situations. So dopamine levels are higher, executive function tends to be improved. But the moment they hit that red line and the stress gets to a certain point, then that relates to, unfortunately, a reduction in performance. And so again, understanding this about yourself is helpful in understanding, what the treatment strategies are going to be. So in this study, they looked at how under conditions of increased dopamine release, which is stress, individuals, and this is the VAL, this relates to an amino acid, VAL allele, have improved dopaminergic transmission, better performance, while the opposite mutation, the methionine, they have less efficient neurotransmission and worse performance. So this is, knowledge for you to take home and understand more about yourself. We can also identify individuals in specific subpopulations. So women postmenopausal, so menopausal, postmenopausal women with certain gene variants will have a higher predisposition towards depression. So this is key. Not all women will develop depression, but knowing this about yourself, when you hit the menopausal timeline, then you can put things in place to hopefully prevent decreases in mood and the prevalence of depression. So what this is doing is it's helping us to really provide an individualized treatment as well as hopefully prevention. That would be the best case scenario. So what's interesting when it comes to depression, there's a 21.7% rate of treatment-resistant depression. So what this means is that when you look at treating an individual with depression with antidepressants, it's the failure to achieve remission with 2 or more adequate medications. And what happens in these individuals, it takes time to figure out what is the appropriate cocktail, what is the appropriate dose, and pharmacogenomics. So this is a little bit different than nutrigenomics, but pharmacogenomics will help to identify, is there a specific therapy that's going to circumvent the treatment-resistant symptoms or depression. So we find that there's gene-drug interactions, so how your liver, specific genes and enzymes within the liver, how they process these drugs, that will influence your response to some of these medications, as well as what I talked about is specific gene nutrient interactions. So, often what I say is when we look at the use of antidepressants, we're using these to modify the neurotransmitter balance, but it's not, for some individuals, there may not be a deficiency of this quote unquote antidepressant. It's a deficiency of a lot of nutrients which are needed to produce the neurotransmitters. So even if you give an antidepressant, but somebody has low capabilities of producing these neurotransmitters, then unfortunately giving them an antidepressant, you may not be helping them too much to adequately supply the brain with these neurotransmitters. So it's important to replenish the nutrients and understand some of these genetic predispositions. So, as an example, a study was looking at individuals with a certain gene mutation called MTHFR. So this helps us to process certain folic acid or folate, which is B9 vitamin. And so what they found is individuals with the MTHFR mutation, if they were given a certain form of active folate plus their SSRI, then they had a greater response. And it wasn't insignificant. It was 50% improvement from baseline symptoms. So that's a significant improvement versus the controls, which were just given SSRIs who had lower improvement rates. So pretty significant. I've seen a lot of patients, unfortunately, who have experienced depression, who have gone through months and even, upwards of a year trying to figure out what medication is right for them. And doing some of these testings can kind of take the guesswork out of it. So just to kind of hit the point home, higher vitamin B12 levels also predicted a better outcome for individuals with major depressive disorder. The individuals who have a risk for vitamin B12 deficiency are the ones who are going to have the best response to B12 therapy or interventions. This is, again, a study that I mentioned related to MTHFR. This is helpful in treatment-resistant depression. So they did, as I mentioned before, a 60-day randomized control trial where they gave SSRI plus methylfolate, and they had a 50% improvement in baseline symptoms. So these are the nutrients that are really important for mental health. I want you guys to kind of take this home. And I'm not going to take up too much more time. I want Dr. Levy to have some opportunity to speak. And I'll let you take it from here, Dr. Levy. Thanks so much, guys.
Thanks, Robin. No, it was very important what you had to say. We've been saying this at DNALabs since we created the test, because we believe that what's unique about the Love My Health and the Love My Health Pro is it's an actionable test. When you get your report, you can read exactly, as you showed us, what were the key takeaways on mental health. And we'll circle back. We will circle back to this, because I'd like to talk after and have a discussion with you and Dr. Morty Levy on the effects of COVID and how we have been more susceptible and aware to this. Quick introduction of our friend, Dr. Morty Levy. He's he's on our scientific advisory board, and we're really delighted about that. Morty Levy is unique because he has three, he's the only Canadian, in fact, that has 3 professional doctorate degrees: medicine, naturopathic medicine, and chiropractic medicine. And it's really an amazing person. He practices in his private practice at Toronto Integrated and Functional Medicine Clinic here. And he's very well sought after, just as you are, Dr. Robin Murphy. I'll turn it over to Dr. Morty Levy, and we'll circle back on the conversation after.
Thank you, Michael, for having me. Let me just share the screen. There we go. Okay, so thank you, Robin, for this great presentation. You see the slide here? Yes. Okay. So the topic of today, I tried to make it fun and simple by discussing a case that I've had in my practice and pertaining to nutritional genomics. Before we begin, I'd like to make some disclaimers. This presentation, of course, is for educational and informational purposes only. It's not to be construed as medical advice, and it's not here to replace medical advice offered by your physician. I have no personal or financial interest to declare. The material used in this presentation is a professional opinion by me. It's not a representation of any professional association or regulatory body. So let's begin. So my case is going to be about a patient that I've seen not too long ago. And for the sake of this presentation, we call it Vegan Charlie. So 40-year-old Charlie became vegan about 2 years ago, just before COVID, 2019, roughly October 2019, after watching a Netflix documentary show about the benefits of a plant-based diet. So he used to eat meat and dairy and eggs and everything else, but he switched to a full vegan diet roughly 2 years ago. And Charlie's chief complaints were that he's getting sick often and he's worried about contracting COVID-19. He also suffers from IBS, irritable bowel syndrome, with constant bloating and intermittent episode of constipation, mostly constipation, then loose bowels. He also started to have eczema throughout his body, and he suffered from chronic fatigue. He always feels tired, his brain fog. He started to notice vision issues, mostly in the morning. He can't tell the difference between dark and colors. And he also complained about cold intolerance and that he's starting to wear socks to bed at night. So I found all those buzzwords very interesting. And Charlie did what most of us will do. He went to his family physician. And when he went to the family doctor ran some blood work, typical blood work, checked for sugar, cholesterol. He also checked his thyroid and his CBC. And he advised Charlie, because of his rash and eczema, to see a dermatologist, and because of his vision that is declining, to see an ophthalmologist. Charlie also received the flu shot. He does it every year, and he had both COVID Pfizer vaccines, but he still said that he was getting the sniffles quite a bit. So he found that his immune system is not the same as it was 3 years ago. So the medical management was as follows. The dermatologist prescribed him with hydrocortisone cream for his chronic dermatitis. He went to see an ophthalmologist to change his prescription glasses. And his family physician prescribed Charlie with Metamucil's fiber and lactulose for the IBS-C, which is mostly constipation and bloating for this irritable bowel case. Now, when I investigated in my office for the review, his diet is mostly in gluten-based grains. He eats a lot of legumes, as he saw in the Netflix show. And he consumed about 2 to 3 fruits and vegetables per day, mostly apples and potatoes. And he thought it was good. Charlie's also an accountant, high-stress job, and he doesn't spend any time outdoors. He was advised by his physician that supplements are useless and to continue his diet because both his sugar and cholesterols were low. Now, when I saw Charlie and I did my workup, he presented with nutritional genomic, and he decided to pursue and do the test. And I'm just going to go over key findings that we found out through this lab that made such a difference in his quality of life. So those are the main 4 red flags and high-risk markers that were found in his nutritional genomics. Now, mind you, nutritional genomics doesn't give you a number. It gives you risk-based information, low risk, medium risk, and high risk. It's qualitative test. It's not a quantitative test. So if somebody comes in with a concern about what's my number of vitamin D, what's the levels, we can't really tell, but we can tell if the levels potentially will be low based on those risks, based on those red flags. So the nice thing with this report, it's very user-friendly. It's very easy to read. Anybody can read it. You don't have to be a physician or scientists like us, Robin. You can be anybody. You can be even a high school student and just read it very easily. If it's red, just like intersection. Red is not good. Green is go ahead. Nothing to worry about. Less worried. Yellow, be cautious. So those are the main 4 markers that were shown to be red and high risk in Charlie's case. I'm going to start with gluten intolerance. The second thing was low, potentially high risk to be low in vitamin A. The third thing was low vitamin D3. And the fourth thing was gluten intolerance. So let's look at the markers as it showed on the report. So the first marker that we were talking about is gluten. So Charlie's markers show that he has the HLA gene, resulting in high risk for gluten sensitivity. And to ask your doctor to run some additional confirmatory tests to see if indeed he is positive celiac. And if it is celiac, then potentially eliminate gluten from his diet and to see if the health improves. Now, here's a study talking about non-celiac gluten sensitivities, or NCGS. A lot of patients that I see are showing high risk gluten intolerance, but they're not quite celiac disease. And it's important to know that gluten intolerance is in a spectrum. You can have severe form of gluten intolerance in the form of celiac, where you have atrophy of the villi and you get severe GI symptoms. But you can also have non-celiac gluten sensitivity, in which you may have symptoms but not as severe as celiac disease. And this is what the research is showing us, that gluten sensitivity or intolerance is formed like a spectrum. Any condition forms in a spectrum. So gluten-related disorders have recently been reclassified with an emerging scientific literature supporting the concept of non-celiac gluten sensitivity. New research has specifically addressed prevalence, immune mechanisms, and the recognition of non-IgE wheat allergies overlapping with NCGS and IBS, just like Charlie, which means even if we tested Charlie and we saw that he doesn't have celiac disease, does he still needs to be reducing his gluten intake? Absolutely, because now we know that NCGS can definitely cause IBS-like symptoms like he's presenting. So gluten intolerance, again, is a spectrum from NCGS to severe intolerances like celiac disease. And that may also explain why Charlie's low iron was because of his gluten intake. If you eat the wrong foods, it may block absorptions of additional nutrients, which we'll see later on with Charlie's case. The next test that was positive red or high risk in the genomic was vitamin A. Now, Charlie's vegan, so he is dependent on plant-based sources of vitamin A. We call them carotenoids, like carrot carotenoids, sweet potatoes, pumpkins. Those are all the carotenoids family. However, genomically, Charlie's ability to convert carotenoids into vitamin A is impaired, which means he can eat all the carrots in the world, but will his vitamin A be sufficient? And medically, we know that vitamin A deficiency can cause things like poor immunity, dermatitis, just like Charlie, and night vision issues, the ability or inability to move from dark to light, to see color. So these are all symptoms that Charlie presented, but the typical visit to the family physicians, most doctors will not check their vitamin A, as we saw in that case. But for me, that was a red flag to pursue the testing and see maybe indeed, since he switched to a vegan diet, his vitamin A is lacking. And because he's not consuming things like fatty fish and eggs and dairy, potentially his vitamin A is low. So Charlie's inability to convert carotenoids to vitamin A impaired, in fact, his night vision, but potentially negatively impacted his immune function. When I tested his vitamin A, it showed that his vitamin A were severely low, which was, again, a screening test. I look at the genomic as a potential screening test. So vitamin A deficiencies, as I mentioned before, can cause chronic skin issues. In Charlie's case was dermatitis. So do you really think hydrocortisone cream will help in that case? I don't think so. You're dealing with addressing symptoms, and the potential benefit of doing nutritional genomics is to look at the root cause and go there. If there's a potential deficiency and this is screening positive, let's do some more investigation and confirm this. Here is another study showing vitamin A and the risk of increase the risk of infection and immune dysfunction. Vitamin A deficiency impairs innate immunity by impeding normal regeneration of mucosal barriers, damaged by infection, and diminishing functions of neutrophils, which are a form of white blood cells that fight infection. So Charlie complained about the sniffles, even though he had the flu shot, even though he had COVID vaccine. And again, we have to look at how the body's physiology is working. Is he deficient in nutrients that will affect his immune functions? And in that case, it was true. So vitamin A deficiency diminishes antibody-mediated responses directed by Th2 cells, although some Th1-mediated immunity are also diminished. So there's a clear correlation between vitamin A deficiency and poor immunity, not just skin and night vision. The third marker that came as a red flag was vitamin D. So vitamin D, as we know, is important for bone, for growth in the case of kids, and also immunity. Now, that showed here that vitamin D deficiency is potentially low, and that was not part of the typical workup that his family physician did. And I advised Charlie, you know what, maybe it's a good idea that we test your levels of vitamin D. And again, the comment was, well, my doctor said everything was fine with me. Should I really test it? It's not covered by OE. Look, why not? I mean, you spend the money on doing the genetic testing. Let's see if the levels are so low, and if they're low, maybe we should address those. Charlie also advised me that he's not spending any time outdoor. He's a chartered accountant, so he's spending a lot of time, especially during the pandemic, 2 years, indoors only. So that was another red flag to consider, that his vitamin D were about to be low. Another article about the function of vitamin D and in use of disease and immunity. Vitamin D, aside from the importance of bone formation, vitamin D deficiency is associated with higher risk of autoimmunity in genetically predisposed subjects, and increase in susceptibility to infections, viral or bacterial. In addition, high dose of vitamin D can improve immune health, prevent autoimmunity, and improve defense against infections, potentially. So in addition to low levels of vitamin A, Charlie's serum levels of vitamin D was 18, which is severely low. So he had the severe vitamin D deficiency. Their normal levels of vitamin D are 75 to 250 nanomoles per liter. Vitamin D deficiency can potentially cause immune impairments. The fourth big markers that we discovered with Charlie was glutathione. So glutathione is very, very important for immunity, but also is the master detoxifier. It is one of the most important antioxidants that your body makes through the liver. And in Charlie's, glutathione detoxification process was, again, high risk or red flag. It doesn't show us a number. It doesn't show us what the level was. It just gave us a screening tool to go by. So red, we know, is high risk, which means not good for Charlie's case. And it gives us the platform in which we can begin and address and make changes in Charlie's physiology and hopefully impact his quality of life. So glutathione is an antioxidant. It's compromised largely by 3 amino acids, glutamine, glycine, and cysteine. And as I mentioned before, it helps the body's ability to detoxify. It reduces oxidative stress and inflammation, and may positively impact our immune response. Supplementing with glutathione precursors or glutathione itself improve the mitochondria function. Mitochondria, for those who are not sure what it is, mitochondria is the powerhouse of the cell. Without the mitochondria, we are low in energy. We can't really function so well. We may have brain fog like Charlie. We may have fatigue and poor immunity like Charlie. Glutathione also reduces oxidative stress. Oxidative stress, if you want to think about when you cut an apple and you leave it out in the air and turns brown, that's what oxidative stress. It's pretty much accelerated aging. So when we reduce oxidative stress, we help our physiology, our cell, cope with those oxidative compounds. So glutathione is an antioxidant. It is one of the most important antioxidants that we need. And it's also anti-inflammatory and potentially enhance immunity. And so far we saw that not just the vitamin A, vitamin D, but also glutathione deficiency in combination may have been the total picture, like a perfect storm in Charlie's case, that caused his poor immunity, skin condition, night vision, brain fog. So it was a case of a perfect storm with multiple things going wrong. So here's an article about glutathione and immune function. So the immune system works best if the lymphatic system, have a delicately balanced of intermediate levels of glutathione. Even moderate changes in intracellular glutathione levels have profound effects on lymphocyte function. Certain functions, such as the DNA synthetic response, are exquisitely sensitive to reactive oxygen intermediates, and therefore are favored by high levels of antioxidant glutathione. So now we know that if we raise Charlie's glutathione, it might have an impact on his general well-being and quality of life. So how did we treat Charlie? So first of all, we looked at the diet and we told him, look, based on your genomic results, we should expand your diet to more food choices. We can't restrict your diet to just purely vegan unless you want to go heavily on supplements. So we maybe add some more food groups, preferably organics. We supplemented this diet with vitamin A, vitamin D3, NAC, along with digestive enzymes and probiotic for his IBS. And we advised Charlie to reduce gluten from his diet. So after 3 months, we did the follow-up. Charlie decided to follow a gluten-free pescatarian diet, including fatty fish, goat milk, and organic eggs. After following the new diet and taking the supplements as directed, within 3 months, he noticed that his IBS-C symptoms went away and his skin cleared up, no hydrocortisone. His serum levels of iron went up, his vitamin A and vitamin D3 are now in ideal ranges. And for the past month, he had no symptoms of runny nose or fatigue. I just wanted to end with a quote. The doctor of the future, this is a quote by Thomas Edison from 1903, even way before we had those great labs like nutrigenomic testing. Thomas Edison said, "The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease." And I'd like to emphasize again, like what Robin said, the benefit of genomics is not just to address chronic issues like in the case of Charlie, but it's also beneficial in the case of prevention. So you don't have to be sick to do the test. You can also do it in order to prevent disease. Just like the quote says, if you can improve your diet, maybe supplement a little bit based on your nutritional genomics, we can extend and improve quality of life and prevent disease. Thank you very much for your time.
Thanks, Morty. I have to remind everyone listening that if you go back, Morty, and as you and Robin have educated us, that a few years ago, a test similar to what we have developed now couldn't have existed. The technology wasn't there. The costs would have been prohibitive. And as we've gone on, and we know this at DNALabs, as we've produced our test, we believe it should be available to everyone at an affordable price. It should be able to be read. And thanks to both of you, there are professionals out there who can help educate people very easily. It's really goes to our mantra of being an explorer and why we think this test is great. I wanted to ask both of you, we have a little bit of time for Q&A, but one of the questions that's probably most prevalent that people keep asking me regularly is, give us one takeaway that you've learned from COVID, because it's as if we are all under a microscopic lens. We're your ideal patients because of how we've had to adapt to COVID. But tell us one thing that you've learned through this whole pandemic that's a great takeaway that we can learn from. Morty?
I can,
Robin?
yeah, I'll go ahead. So, I don't know if this is unique to myself, but I have shared this with many of my friends and family and heard it from patients as well, is just, going through the experience of isolation, has really taught me the value of human interactions and community. And, I wanted to highlight depression because one of the, founding factors that lead to that can be isolation. And we've kind of all experienced that in one form or another. But through that, in order to come out of that or train yourself to kind of bear the burden of isolation has been empowerment. And empowerment, and whether it's skills or knowledge that we teach or connecting in innovative ways through technology and Zoom and new ways of doing business and connecting with others, has been really, really meaningful. And so something in my practice that I always love to talk about is empowerment. And when we kind of bring it back to knowledge, knowledge is power, to be cliche, but this type of information, it really does empower people to kind of take ownership of their health and be an active player. And I think, what coming out of this, a lot of people are kind of saying, well, what can I do to make a significant difference in my life and be an active player moving forward?
Thanks, Robin. Over to you, Morty.
So what I did that in my home and in my practice when I advised patients initially remotely, because my practice was limited to telehealth for a big chunk of the the pandemic, was try to make the negative and turn the negative into positive. And because people are more home and my practice is focused on functional integrative medicine, I suggested for families to spend more time in the kitchen and educate their kids about the value of proper nutrition. Now that everybody's home, spend more time in the kitchen and learn how to cook, look into more organic foods. And when you couldn't eat out and you couldn't order in as much, so why not just spend this time? You have all the time in the world. Why not just make the best of it and spend it with the kids in the kitchen and educate them about the nutrients? And I have, I mean, my son Jonah, who was 4.5, 5 at a time, we started to have a contest at home, and what vitamins in his fruit, what do you have in bananas, what do you have in peppers, what do you have in oranges, and they started to learn the importance of nutrition, sound nutrition. Where do you have vitamin C? Where do you have vitamin D from? And why is it important to have whole foods, organic foods, and balanced diets? So we try to make it positive, and I did the same thing with my patients. I said, look, you're indoors. There's limited outdoor interactions. Maybe take this experience and pass it on, because that's all we have is the internet and video chat, and just pass this information to others and educate them and make it fun, make it a fun experience. Go to the kitchen, order some fruits and vegetables, learn about the benefit of good nutrition, maybe order this nutrition genomic test, and learn even more about yourself and how you can improve your diet and nutrition through diet and nutrition and supplements, and make your overall health better, and pass it on to others. And that's what I've been doing in my practice and my own home.
Another question that has always fascinated us, and somebody wrote in, is this concept that good health is not dependent on our age, and that people, and I have parents who are doing reasonably well for their age, but people always say, when is a good time to look at nutrigenomics? Like, when is a good time? And I'd like to get your takes on that, because I think that's important for our audience to know. Morty?
So I recommend testing for everybody. I mean, it's never too late. It's never too late to improve. As you can be a toddler and you want to know about potential benefit and risks about different specific diets that you need to avoid, or take specific supplements moving forward, like vitamin D and so forth. And you can be a senior with osteoporosis and you want to know if the diet that you've had all these years, is it even good for you? And what you should do, what steps you should do to make the next several years or decades of your life a better one, right? So improve. So I don't think there's a limit as far as age. Definitely the younger the patient, the more years you have to benefit from testing, but there's no limit or cap on age.
Thanks, Morty. Robin, what are your thoughts on that?
Yeah, I agree. There's very specific time periods that I'll see parents or individuals be really attracted towards doing something like this. So definitely parents, if there's any sort of history of parental genetic alterations, celiac disease, diabetes, cardiovascular disease, any sort of family history, and they want to kind of get ahead and understand the health of their child, then that can be helpful, especially around predisposition to, say, something like celiac disease. The actual exposure of celiac and the timing and the amounts can influence the presence or development of the disease within children. So knowing that ahead of time, you can actually prevent a lot of disruption in their life, and difficulties by preventing the occurrence. And then, just like Morty said, it's never too late. I think we're also looking at well aging. So there's a whole society of booming individuals that are essentially looking to live their best life. So optimize their health prior to, the latter stages. And you do that through a number of different lifestyle factors, but this test I find it's a very good insight into multiple systems and areas so that people can actually focus. So you're not kind of shooting in the dark, taking all the supplements, taking, an obscure dose. It's really individualized. So it helps you with dosing, helps you with duration, it helps you with follow-up testing. So you're a bit more, stringent with what you're doing rather than the whole kit and caboodle.
Final thought, final question that our customers regularly write us on is the environment. We, especially here in Canada, are very concerned of our environment. We're concerned about climate change. We're concerned about what's happening in the world beyond our own shores. And when I speak to our customers, they link, of course, the environment to their health. And I think the environment we live in plays an important role, even more so in understanding the role that nutrigenomics plays back in. So I wonder if you could speak for a minute, Robin, and then I'll ask Morty to kind of tie in this theme that everybody's talking about today, is our own environment and how we tie that back to health.
Yeah, from a genetic standpoint, there's a saying and kind of metaphor that your genes loads the gun and the environment shoots it. So we all have genetic predispositions and mutations. There's millions of them within our genetic code. And it's really the environment, both microscopically, so around the cells, as well as from a macro perspective. So our external environment and internal environment, which will then dictate the expression of those genes. So there are things that we can do to change our external environment as well as internal. So Dr. Levy, he mentioned the glutathione gene. Some people are missing that gene. So for myself, I live right by a highway. I'm missing one of those genes, so my glutathione pathway isn't as great. So I invested in a medical grade air filter. It gets out all VOCs and ultrafine particles. So I know I'm protecting myself because I'm a little bit more vulnerable in that regard. And so these are the few things you can do to kind of change your environment in response to your genes.
Thanks, Robin. Dr. Morty.
So yeah, so I agree with this. Now with the environment, I mean, the field of epigenetics is just in the infancy. I remember when I was in undergrad over 20 years ago, we learned about genetics, and back then genetics was like as if things were carved in stone and cannot be changed. And now we know that it's not true with the field and evolution of epigenetics. And this test is a prime example of that we can do something about it. And if you have a specific gene, like let's say low vitamin D or low levels of glutathione, doesn't mean that your levels will have to be low. It's how your genomics will express itself. And that's the interaction between the environment, you and individuals, and the things and the actions that you take. Are you exercising? Are you changing the diet according to your genomics? And are you taking specific supplements to enhance and turn bad genes off and turn good genes on? And that's ideally what I encourage patients to do. It doesn't mean that if you have a genetic disease, or predisposed to a genetic disease like heart disease, that you're gonna get it. It just tells you that you're high risk. And now that we know, based on this test, what steps you need to take in order to turn those genes off, right? We call it epigenetics. It's how the genes express themselves or turn on or turn off based on the actions that you take, maybe exercise or nutrition or supplementation. So that's, for me, is a very attractive piece of information that you can share with patients, and the value of this test, and moving forward, how you can improve your quality of life and your loved ones too.
Question that came in through the chat line, and I'll address it. This will be our final question, and then we'll wrap it. Besides the benefit of mega vitamin therapy, I assume, this is what the viewer writes, I assume you provide a list of the risks. So I would like you to comment on that, just so that as people understand that there are risks, and this is why it's important. Our test adds tremendous value to the to the risk management, if you would. Robin?
Yeah, I can tackle that question. I think what the commenter is talking about is, if the test is recommending that you look at certain vitamins and providing a dose, then people need to understand that the dosage is important, and that if you're taking a lot of different nutrients at very high therapeutic doses, then there are risks involved. So in the test itself, it's giving you an understanding mostly about risk for nutrient deficiency as opposed to nutrient excess. And it's always recommended to, be under the care of a healthcare provider when dosing these nutrients. So the test is provided, direct to consumers, but it is recommended to always make sure that you're consulting with a healthcare practitioner so that the dosages and interactions and, specifics to your health and other tests that need to be done to confirm are in place.
Thanks, Robin. Final thought, Morty, on that question?
Yeah, I mean, every test, there's benefit and risk. Any procedure in medicine, there is a benefit and risk. So ultimately, when we discuss things with patients, we have to present the benefits, the alternatives, and risks to a procedure or treatment or even testing. When somebody goes and get colonoscopy, right, the benefit of doing the procedure outweighs the risk. Same thing applies to nutritional genomics. If let's say you suffer from anxiety, and if this information may aggravate, unfortunately, your anxiety, then you have to be cautious who you're recommending the test to and which type of audience. The last thing you want is to have somebody with severe anxiety, for instance, or mental health look at this test and thinks that, if you have moderate or high risk for heart disease, that, you might get a heart attack and drop dead. That's not the point. The point, like I said earlier, is the epigenetics approach, that even though you have moderate to high risk for certain conditions, Alzheimer's or heart disease and so forth, then you can take steps in order to reduce the risk and potentially turn off the bad genes and turn on the good genes. And by thinking about this holistically, and patients are more educated about the benefit and risks, the potential benefit and risks of doing nutritional genomics or pharmacogenomic testing, then everybody is going to benefit: the practitioners, the doctors, and the patients.
Thanks, Morty. I've really enjoyed the chat with both of you. Again, for our guests, Dr. Robin Murphy, Dr. Morty Levy, you're highly sought after. Your advice is highly sought after. And I encourage those watching and those who will see this on a repeat later to contact you if they have any specific questions or would like to discuss their concerns. For us at DNALabs, it's very simple. Our message to our viewers is simple: www.dnalabs.ca. You'll find the list of our products, including the products referred to today in this webinar, our Love My Health and our Love My Health Pro. They're an affordable and an excellent test. I highly recommend it. We say at DNALabs, and we're proud of it, we say it because we believe it, that good health belongs to everyone, absolutely everyone. And we invite everyone to join us on our continued journey. Have a wonderful day. I'm Michael Kersner.
Thank you.
Thank you.
Thank you, everyone.